know Dr. Emanuele Capobianco, who joins me now, is the head of health and care at the International Federation of Red Cross and the Red Crescent Society. Thank you very much, Emanuele, for joining us once again at TRT World. So we've just listened to our reporter there in Italy, and Italians are very concerned. Now it's gone up to 12 towns being under lockdown, and it is spreading even more. And we've heard first cases, for example, in Greece today. What is your view?
My view is that this is an exceptional situation. The cases have increased rapidly over the weekend in Italy, and containment measures were put in place very fast, quite drastically, but those are the right measures to avoid spread of the infection. So we will see the results of the containment measures in the next few days. Right now, we know that the infection has spread to several regions in Italy and abroad to countries like Switzerland, like Austria, like Greece, like Spain. If these measures had not been put in place, the spread would have been much, much wider. And this is a difficult moment for Italians, but Italians are responding positively to that with the help of many that are like the Red Cross providing support to people in need.
So you think the government is handling the situation well in Italy?
I think the government was quick in reacting, and the containment measures put in place are likely to reduce further spread. Whether the containment measure will be able to stop further spread is something that will need some days to confirm.
And as a Red Cross and Red Crescent, what are the preparations so far?
So the Red Cross has been involved before actually the outbreak hit Italy, particularly with surveillance in airport, with transport of suspected cases and now infected patients to particular ambulances that have a high biosecurity. We have also been very involved on the ground, providing the support to people who need it. We talked about elderly. That is a very critical group that is particularly at risk, not only physically, but also psychologically. And the Red Cross is there to provide that support. That may be just a volunteer who goes there and listen and talks to an old person or buys the grocery. These small gestures are extremely important, and that's what the Red Cross volunteers are doing on a daily basis in many towns in Italy right now.
Now, many virologists, of course, are saying we shouldn't be that worried as some of them are very wild when you do have the virus. And as you just mentioned, people with underlying health conditions or elderly will have it worse. But there are also countries who don't have enough resources or hospitals. So what's in place for them in terms of help?
So let me say one thing. The percentage of cases that may be severe and requiring hospitalization is fairly high. So we are talking about 15% of people who get it who will require hospitalization. If there is no containment, these numbers is going to overwhelm almost any system, any health system. So containment measures are doing exactly that, delaying the number of cases and helping systems to respond. When we talk about countries, particularly in Africa, but also in other parts of the world with very weak health system, a coronavirus large outbreak may really create huge difficulties, not only for the treatment of the people that are affected by the viruses, but also for the other people that are served by the health systems that may have other diseases. And the risks are that the infection, if the health personnel is not adequately protected, may impact the health personnel, reducing the availability of doctors and nurses, thus having serious effects on the ability of the system to respond.
Now, Emanuele, just very briefly, as head of health and care, so what can I do to protect myself?
Well, you can wash your hands very frequently and tell your kids and your parents and your friends to do that regularly. You can sneeze by putting your elbow in front of your mouth and not your mouth in front of not your hand in front of your mouth. You can call your parents, the people that are in need. You can have a contingency plan at home so that you know what to do if the schools are closed. You can talk to your neighbors so that you can plan together what to do if the outbreak hits your hometown. A lot is really on the individual responsibility. And let me tell you, the last thing that is super important is watch the news, go to the proper website, because having the important information, the truth information is absolutely critical to be ready to respond with a positive attitude to this outbreak.
Well, I have to wrap it up here, but it's always a pleasure talking to you, Emanuele Capobianco.